welcome back to another episode of Keeping Up with V. As I promised you guys in the last video, I really wanted to talk to you guys about a new vitamin in which I've been using. Excuse me. A lot of my channel is more about finding different ways in which we can either manage our PCOS. Sorry, I'm using my iPad right now. Manage our PCOS or find alternative methods to helping it that do not include metformin or any type of other drug. There's been a lot of talk around metformin and what it's doing for people with PCOS, which has led me to continue to do my research and to continue to look at things in a different eye, or a different way, if you will. So I'm constantly looking up things, reading articles, and one of the things in which people talk about often with PCOS is Vitex and the benefits in which it can bring. Again, I am not a doctor. I've said this before when I talk about these videos. I'm not a doctor. I'm not giving you medical advice. I'm simply telling you what I use and how it's been beneficial to me. So take things at your own risk. If you get sick, if you grow a third arm, if your fifth toe falls off, boo-boo, don't come for me, okay? This is my disclaimer because I ain't trying to have that. Anyways, I found this bottle. This is Nature's Way Vitex Fruit. On the bottle specifically, it says a traditional support of female monthly cycle. It does go into details about it being native to the Mediterranean. This is a flowering tree whose fruit has been traditionally used for women's health support for centuries. And it goes on to say they believe quality comes first. We get our berries from places near the Mediterranean where the climate conditions are perfect. This is true. I have no idea. Nature's Way could be bullshitting me, but you know what? I found it at my local HEB. I believe this was 8 bottles. 8 bottles. This was $8. And it comes with 100 vegan capsules, and it's 400 milligrams per serving. From my understanding, that is the normal dosage that you should take. I'm reading different things online. Although the bottle does say to take 1 capsule 2 or 3 times daily for 8 to 12 weeks. Thereafter, take 1 capsule daily. Best results obtained with continuous use. I will say that I started this last Monday. So we are the 28th, which is Tuesday. I don't know what day that was, but I started last Monday. I have been taking 2 pills a day. I take 1 usually in the morning and then 1 in the afternoon or with my evening dinner. This is what the capsule guys, I cannot talk. This is what it looks like. It's just a typical vitamin capsule. It doesn't have a horrible taste. It does have some sort of taste, but it's not the worst. But I can say from my experience from last Monday to today, taking the pills as I mentioned, I started spotting on Sunday, which was, today is my cycle day 3, or however that works. I could tell instantly on that day, like, it was just, I wasn't experiencing a lot of bloating. You guys can tell when you're about to start, and I was thinking like there's no way. If you've watched my last video, I kind of mentioned to you guys how I had been spotting off and on from taking the progesterone, and I really hadn't had a full period since, or not a full period, but a regular period since the middle of October. So I've of course been watching this, and that's kind of what led me to want to take the Vitex, just to see how things would help. So I'm just going to read from you an article. Again, this is not, this is just research in which I've done. Do not quote me. This is just something that I found important. Not reputable, because anybody could write this, but anyways, you guys know what I mean. So it says, Vitex earns a place in this person's top 5 favorite herbs for women. And she goes on to explain that This is a powerful herb that can help you with your hormones. Hormonal imbalances are one of the most common complaints that she sees in her practice and includes conditions like, mind you, this is a doctor, so I didn't just go find some Joe Schmo who wrote a Wikipedia article, guys. So it says conditions include PMS, irregular menstrual cycles, polycystic ovarian syndrome, fertility challenges, and menopausal symptoms, which I ain't there yet. I'm not trying to be there yet, but I click or check 3 of those. I have irregular cycles, polycystic ovarian syndrome, and fertility challenges. So 3 out of the 5 that she listed. She goes on to say that robust scientific evidence now supports the traditional use of Vitex for women's hormones, and she's going to walk us through what you need to know in this article. I'm not going to read everything. It goes on to speak about PMS. She speaks about irregular cycles. Regular use of Vitex has shown benefits for irregular menstrual cycles. This includes frequent or heavy periods, painful periods, and lack of menstruation. Elevated prolactin can be a cause of amenorrhea, and Vitex, if I said that right, I have no idea. And Vitex has been shown to help prolactin levels to keep them in check. In a controlled trial, prolactin production was normalized in women with high prolactin levels after 3 months of treatment with Vitex. It's also been shown to increase luteinizing hormone levels and subsequent progesterone levels in women with luteal phase defect, a condition that can also lead to menstrual cycle imbalances like amenorrhea. I don't know that word. But these are all things in which I've been told by my reproductive endocrinologist that I do have. So that kind of like, lit a light bulb. It said that a preliminary trial found that 10 out of 15 women began having a normal period after taking 40 drops of liquid Vitex preparation once a day for 6 months. Another study included women with subfertility and showed improved menstrual cyclicity following treatment with Vitex compared to placebo. Oh, really? Then PCOS. It says Vitex extract regulates ovulation, increases fertility, and improves progesterone in women with PCOS. It is an increasingly common and complex reproductive and endocrine disorder causing polycystic ovaries, chronic anovulation, and symptoms of irregular menstrual cycles, acne, and infertility. So we already know what PCOS is. If you have it, you know what it is. She also sends more information that if you want to read about it, you can. I'm going to try to link this article down below, but again, I like to present you guys with information in hopes that you will go do your research yourself, because I don't want you to be biased and be like, oh, well, because Veronica said it means that it's good. I can't say that. It's just what I believe to be good because I found the research. So it goes on to talk about fertility and pregnancy. Vitex promotes fertility, particularly in cases of established luteal phase defect or shortened second half of the menstrual cycle and high levels of the hormone prolactin. In fact, one of the side effects in some of the clinical trials that have been done is that women have become pregnant. Okay. It has also been used to prevent miscarriage in women who have a history of miscarriage, possibly due to effects on progesterone. In one trial, 48 women ages 23 to 39 who were diagnosed with infertility took Vitex once daily for 3 months. 7 women became pregnant during the trial, and 25 women experienced normalized progesterone levels, which may increase future chances of pregnancy. There's a whole lot more that it goes on to say, but it mentions it's not harmful and you can feel confident becoming pregnant on it if you used it for fertility purposes. At lower doses, it is commonly recommended for breastfeeding support and to increase lactation. However, at the higher dosage range could suppress breast milk production, so stay within the lower doses mentioned in the article. So, again, I've showed you guys quite a bit of different things. I've showed you the myo-inositol that I've been taking, which I still take daily. I've showed you guys the fertility tea, which I have pulled off of simply because of everything that's been going on with my body. But I'm still taking my prenatal vitamin. I'm still doing my B12 and my vitamin D. I have noticed, when I do not take my vitamin D for a long period of time, I'm so drained. I don't have any energy. I'm just extremely tired. So I have tried staying consistent with taking that as much as I can. But I would really highly suggest you look into this, not because, again, I'm not promoting them. I don't have any kind of partnership with them. They're not paying me to say this. You could go find another brand of this. This is just what I had at my store. This was honestly the first bottle that I came across in my local HEB. But clearly, when you research what PCOS is, it's a hormonal imbalance and things that we lack. If you can get yourself to a better place by simply taking a vitamin that's beneficial to your body, there's a room for improvement, or there's a good enough reason for you to educate yourself and look into these things. Now, please be mindful that PCOS, the whole reason why it's so complex is because every person or every woman is affected differently. So what PCOS has done for me, maybe not, you're not having those irregular cycles, or maybe it's not that you don't ovulate. So please be mindful. If those are not things that you're experiencing with your PCOS, make sure to read upon this and see if it's truly for you. I just know, because of prior going to the doctor and really knowing what's going on with my body, the things that I lack, the things that I need, this just seemed like a really good thing for me to do. Again, please do your research. Is it coincidental that I started taking it Monday and I started my period Sunday? I don't know. Could it be the Vitex? I want to say yes. I've continued taking it. I really want to get to a place where I don't have to rely on letrozole or these shots to overinduce my follicle growth, because last time I spoke to the doctor, these shots will help me get pregnant, but she's almost confident that it will cause multiples. Now, I'm already overweight. I'm already putting myself in a place where I've had cancer. Now I'm trying to carry a baby. I do worry about the possibility of carrying a multiple pregnancy, which, don't get me wrong, I would love twins. That's always been a joke in my family. Twins run in my family on my dad's side. So it's always kind of like a running joke, like, oh, somebody's bound to have twins. And I would ultimately love twins, but I just worry on the effects in which it will help or have on me, because I, at the end of the day, want a healthy pregnancy and, of course, a healthy baby. So these are just things that I feel I can do to help better the situation. So again, I hope you guys will look further into this. If it's something that you feel your body can benefit from, then by all means, let's talk about it. Maybe you've tried it, maybe it didn't work, maybe you noticed it did work. This is why I kind of like having these conversations with you guys, because I want to know how it helped you or how it didn't help you. So I hope that helped. Again, I will make some more videos coming up for you guys soon. I'm still looking into the giveaway. If you guys want, please leave a comment below. Like, tell me what you guys would like in a giveaway. Do y'all want the pink stork fertility tea? Do y'all want some of the candy, which I still happen to have here? Would you like the inositol? Maybe you want a bottle of Vitex, or how about I make like a package of everything, like the vitamins that I take. I need to kind of figure out again, like what I can do. Maybe have you guys kind of like go follow my Instagram, just so that we can be connected, and like that's how you enter. I don't know, we'll figure it out. But again, until next time, guys, catch you later.